So Venetoclax is a BCL-2 inhibitor. So BCL-2 is a family of proteins, actually helps the cells survive variety of different toxic stimuli like drugs that we use to treat the cancer cells. So by targeting the BCL-2, we can potentially make these cells die, and which is what we found in the lab, is that when you use a BCL-2 inhibitor like Venetoclax, the myeloma cells do die. And we also found that combining the BCL-2 inhibitor with other drugs like proteasome inhibitor clearly enhances the ability of that combination to kill myeloma cells. So based on that, there was this phase 1 study that was done looking at Venetoclax as a single agent in patients with relapsed myeloma, which was a phase 1 study with a expansion of the safety expansion at the recommended phase 2 dose. So it's a total of 66 patients were enrolled on this study. What we found was that overall the drug was very well tolerated. There was very little in terms of toxicity. Toxicity was very similar to what we have seen with Venetoclax in the other cancers, mostly hematological toxicity and some gastrointestinal toxicity, both of which was very easy to manage. In terms of the efficacy, 20% of the patients actually had a response to the treatment. Now this is quite interesting because these patients had a median of 5 prior lines of treatment, with some as high as 15 prior therapies. So it is a very heavily pre-treated group of patients. Like 3/4 of the patients are refractory to bortezomib, refractory to lenalidomide, and almost 2/3 are refractory to both the drugs. Despite that, we did see a 20% overall response rate. But what was most striking was that if you look at the 30 patients who are translocation 11-14 positive, the response rate was 40%. So clearly within that group of patients, this drug seems to have a very high activity, and which was predicted based on what we saw in the laboratory in the patient cell lines. Even more interesting is that when you actually look at certain biomarker type strategy, by measuring the BCL-2 levels and the BCLXL levels, the ratio of those two seems to better define the myeloma that is actually going to respond. And using that criteria, we can identify a group where there is an 85% response rate. So this totally opens up the possibility of doing a biomarker-directed therapy in myeloma, for one, and two, having a drug that's very efficacious in a particular genetic subgroup of patients in whom the other treatments don't necessarily work very well. So the results are quite exciting, and this is moving forward in phase 3 trials.